On a sidewalk, a woman holds a backpack. Text, Birmingham in Mind, University of Birmingham. Why is youth mental health research important and how can philanthropy make an impact? Professor Matthew Broome, Director of the Institute for Mental Health.
What became clear to mental health practitioners and researchers is that half of mental health problems begin by the age of 14, so very young, mid-teens, and 3/4 by the age of 25. So if you generalise that model and want to intervene early across all mental health problems, you have to go back to quite early on in people's development, so early teenage years. And intervening early is the best way to prevent long-term chronic mental health problems that may persist throughout adulthood and into later life. I think the important thing for us is that philanthropy allows us to do studies that we might not otherwise be able to take part in, and also do things at a certain speed and pace that otherwise can be difficult to do. So an example I would give is we're very fortunate to have attracted funding from HSBC for this intervention into bullying in schools. And I guess what's really exciting for me about that is, over my time as a psychiatrist, it's become increasingly clear that early life experience is linked to mental disorder, and not just, I guess, mild mental disorder, but things like schizophrenia. And bullying is one of those early traumatic events that is key to that. And it's one of those big mysteries, actually, is why we don't do more about it, because it's one of those things that is cost effective, and every pound you spend intervening in bullying generates so much tax to the economy and can have knock-on effects to people into their middle age. So having the donation from HSBC allowed us to take an internationally recognised intervention developed in Finland that had been trialled in North Wales, but allows us to begin implementing it in inner city Birmingham. And without the philanthropy, we couldn't have done that in a kind of agile and straightforward way. Obviously, we've been a bit disturbed by COVID because of schools closing down. We managed to get the pilot study done. We got people trained up in Birmingham. We got the training developed in Finland used in Birmingham schools to see if it had validity, if they could understand it, if it made sense, and progressing now with part of a wider national study showing how this could intervene. So the hope is not only will it make children less distressed now, but also those children when they're 50 will have better outcomes in terms of their relationships, their work and their quality of life. Mental health and physical health are very closely intertwined. So helping these things helps in all sorts of ways. And I think without HSBC, that work wouldn't have been possible, because it's very expensive to send teachers away to be trained in these things, to get all the materials into schools, and very practical stuff of teachers are very busy at the best of times, so the funding allowed us to achieve very practical, on the ground implementation, which many thousands of kids will benefit from in Birmingham now.
Birmingham in Mind, University of Birmingham. Creative Media, University of Birmingham.